Hey, you. Thanks for tuning in. You sent us some really interesting stuff this time, articles and even a scientific study all about red light therapy.
hmm
Specifically, how it might help with those, annoying nasal issues. Hay fever being a big one people mentioned.
Yeah, that came up quite a bit. The idea of something simple, maybe affordable, giving some relief,
Mm.
it's definitely appealing.
It is. So, for this deep dive, we're going to get right into it. Nasal red light therapy. We'll look at what it actually is.
How it's supposed to work.
Right. And what the research and those other pieces you sent suggest about effectiveness, especially for allergic rhinitis,
Yeah.
which, yeah, includes hay fever.
We'll touch on the claim benefits too, and importantly, things to keep in mind, like costs and any potential side effects.
Yeah, our aim here is just to unpack it all, cut through the noise maybe, so
There
you
you go.
can finish this with a clearer picture, see if it's something worth exploring for, sniffles and sneezes without needing a PhD.
Sounds like a plan.
Okay, let's dive in then. What exactly is this nasal red light therapy?
Well, fundamentally, it's about shining a specific type of light, low-level red light, usually in the 630 to 660 nanometer range, directly inside your nasal cavity.
Okay.
The technical term you might see is intranasal photobiomodulation. Bit of a mouthful.
Yeah, just a bit.
But think of it like using targeted light inside the nose. The devices usually have small LED lights, and you sort of gently place them in your nostrils.
And how long for?
Typically, based on the info we saw, somewhere between maybe 5 and 20 minutes a day.
And it sounds pretty accessible, like not some super expensive medical device.
That's a key point from one of the articles, yeah.
Yeah.
It mentioned you can often find these things for like under 20 quid on Amazon.
Wow. Okay.
And it even pointed to a resource, redlighttherapy.rehab, as a place to get more info and even find links to nasal devices for under a tenner.
Under 10 pounds. Okay, for someone suffering badly with hay fever, that definitely falls into the might as well try its category, doesn't it?
Absolutely.
Yeah.
That low cost is a big factor for many people, I think. So, okay, how is this red light supposed to actually do anything up there?
Yeah, what's the theory?
Well, it gets down to the cellular level, really. The informational source explains that red light therapy, generally, is thought to stimulate our cells, specifically the mitochondria.
Ah, the powerhouse of the cell. Takes me back to biology class.
Exactly. Think of them as tiny batteries powering everything. So the idea is this red light gives those cellular batteries, particularly in the nasal tissues, a bit of a boost.
So like an energy drink for your nose cells?
Sort of, yeah. That's a
Yeah.
decent analogy. When the light hits the inside of your nose, which is full of blood vessels and sensitive tissues, and close to the brain too,
Right.
it interacts with those cells. The info you sent suggests a few potential mechanisms. One is increasing ATP production. That's the main energy currency for cells.
Okay.
It might also improve blood flow and circulation locally, maybe help get more oxygen to the tissues. And there was some mention of potential neuroprotective effects, though that's less direct for allergies.
And using the nose makes sense as an entry point. Yeah, like you said, it's right there near the sinuses, the bloodstream, close to the brain. Seems strategic.
Totally. It's a very direct route to potentially influence those tissues and maybe even have wider effects because of that proximity to the bloodstream and brain. But the main goal here is tackling the nasal issues directly.
Gotcha. Now, you mentioned a scientific study you looked at, something about rhinophototherapy.
Yes, red light rhinophototherapy, or RLRPT. The study specifically investigated its effect on allergic rhinitis, which is perfect for our discussion, since hay fever is seasonal allergic rhinitis.
Okay, so what was the study trying to figure out exactly?
They had a focus question. Did this RLRPT actually improve nasal patency in people diagnosed with allergic rhinitis?
Nasal patency. So how easily air flows through the nose, like how blocked up you feel.
Precisely. How open or obstructed the nasal passages are.
Okay, and how did they test it? What was the setup?
They took patients with allergic rhinitis and divided them. Group 1 got a single session of RLRPT, it's 15 minutes, using 660 nanometer light, 40 milliwatts per nostril.
Right.
And then they started standard medical treatment, a steroid nasal spray and an oral antihistamine.
Okay, so light first, then meds. What about group 2?
Group 2, the control group, just got the standard medical treatment, no red light session beforehand.
Ah, okay, so a direct comparison. And then they measured what?
Two main things. First, the patient's own reported symptoms, stuffiness, runny nose, itching, sneezing, all that stuff.
Yeah.
They asked about these before the RLRPT, then 30 minutes after, and again 2 days later.
So how people felt.
Yes.
Yeah.
And second, objective measurements of nasal patency. They used specific tests, active anterior rhinomanometry, and acoustic rhinometry before the white session and 30 minutes after. These give actual numbers on airflow resistance and the physical dimensions inside the nose.
Okay, so subjective feeling and objective data. What did they find? Let's start with the symptoms, how people felt.
This was quite interesting. They found a significant improvement in all the symptoms they measured: congestion, runniness, itchiness, sneezing. The total score just 30 minutes after that single RLRPT treatment.
Wow, 30 minutes. That's fast.
It is surprisingly quick, yeah. People reported feeling better quite rapidly.
But I sense a but coming.
Well, yeah.
Yeah.
The study also found that symptoms, particularly sneezing, tended to worsen again by the 2-day follow-up, even though they were using the meds.
Okay.
And here's the other key bit. The group that only got the standard meds. They also showed significant improvement in all their symptoms after 2 days.
Ah.
And critically, when they compared the symptom scores between the two groups at that 2-day mark, there was no significant difference.
So the red light gave a quick initial boost in feeling better, maybe, but after a couple of days on meds, both groups felt about the same. It didn't add a lasting advantage over standard treatment in this study.
That seems to be what this specific study suggests, yes, based on that single treatment protocol.
Okay. Now, what about those objective measurements? Did the red light actually physically open up their noses?
This is where it gets even more nuanced. They found that nasal resistance, how hard it is for air to get through, did decrease slightly 30 minutes after RLRPT, and airflow increased slightly.
Yeah.
But neither of those changes was statistically significant.
Meaning it could have just been chance, not a definite effect of the light.
Essentially, yes. The numbers moved in the right direction, but not strongly enough to rule out random variation with statistical confidence.
That's surprising given people felt less congested.
It is, and there's more. Looking at the acoustic rhinometry results, which measures the space inside the first narrowest point near the nostril opening, didn't really change.
Okay.
But interestingly, the second narrowest point, believed to relate more to swelling further back, and the volume of the nasal cavity in that region actually decreased significantly after the RLRP.
Decreased, so it got smaller. That sounds counterintuitive if you want to breathe better.
Well, the interpretation in the study was that the second area relates to the swelling of the turbinates. Turbinates those structures inside the nose that swell with allergies. A decrease in that cross-sectional area might actually reflect a reduction in that specific tissue swelling.
Ah, I see. So maybe less swelling in a key spot, even if the overall airway measure didn't significantly improve right away.
That's one way to look at it. But the study's overall conclusion, based on all the objective measures, was that a single RLRPT treatment didn't objectively improve nasal patency.
So short-term feeling better, but no clear physical widening of the airways immediately after one go. Did the researchers suggest why this might happen? Why feel better if the nose isn't technically more open?
They discussed a few possibilities. One was potential immunosuppressive effects. Maybe the light calms down some of the immune cells causing the allergic reaction. They also mentioned the slight heat generated might affect blood supply or histamine release. And crucially, they suggested the feeling of less congestion might be because the treatment reduced nasal discharge, the mucus.
Ah, so less stuff in the nose, even if the tunnel itself isn't much wider.
Exactly. That could certainly make you feel less blocked up.
That makes a lot of sense. Did the study mention any limitations, things to keep in mind?
Yes, definitely. The potential for a placebo effect is always there, especially when people know they're getting an active treatment.
Right.
Also, and this is a big one, they only looked at a single treatment. Standard protocols often involve more frequent, longer-term use.
So maybe the effects build up over time.
It's possible. The study can't tell us that. And finally, it only included adults, so we don't know about kids.
Okay, that's really helpful context. So let's tie this back directly to hay fever then. It's that seasonal allergic rhinitis pollen, dust, mold, triggering sneezing, runny nose, congestion, itchy eyes, brain fog, all that fun stuff.
Exactly. And as those informational pieces highlighted, many people find standard antihistamines or sprays don't cut it completely, or they worry about using them all the time. So a drug-free option like this nasal red light sounds interesting.
So based on everything, the potential mechanisms like stimulating cells, improving blood flow, maybe reducing histamine, plus the studies hint at short-term symptom relief, what are the hoped-for benefits for hay fever sufferers?
Well, connecting the dots, the hope is that regular use might reduce that nasal lining inflammation,
Okay.
potentially decrease histamine release, leading to less sneezing and congestion, maybe help open passages for easier breathing over time, even if that one study didn't show it immediately.
Right.
Perhaps improve blood flow to help clear allergens faster, and ultimately maybe reduce the need for pills and sprays.
And one of the articles did claim clinical trials showed significant improvement in hay fever symptoms compared to placebo, citing a different source. So there might be other research out there suggesting benefits with more regular use, perhaps.
It seems plausible, yes. Our specific study looked at one snapshot after one treatment for general allergic rhinitis. Broader claims about hay fever likely draw on different evidence or protocols, perhaps involving daily use over weeks.
So who's the ideal candidate for trying this based on the info?
It seems like it could appeal to people with seasonal hay fever, obviously. Also, maybe those with year-round allergies to dust or pets. And definitely people looking for natural or drug-free options, or wanting to avoid medication side effects. It could be an add-on therapy, too.
Now, practically speaking, we know it can be cheap, possibly under a tenner from places linked on redlighttherapy.rehab. How easy is it to use, and are there downsides? Side effects.
Usage seems pretty simple. Pop the LEDs in your nostrils for 5–20 minutes daily. The study suggested it was generally well tolerated.
But there were some mild side effects reported in that study.
Yes, a few people mentioned a temporary burning or pain around the nostril, and a couple had mild headaches soon after. These seemed minor and short-lived in the study.
And the informational source had some warnings, too.
Important ones, yes. Avoid if you have photosensitive conditions or take meds that increase light sensitivity. Stop if irritation occurs, and consult a doctor. And it's generally not advised for kids without medical guidance.
Good to know. Standard precautions, really. Seems relatively safe for most adults, but checking with a doc if you have underlying conditions or take meds is always smart.
Absolutely. Sensible advice for trying any new health approach.
Okay, let's wrap this up. What are the key takeaways for our listener from this deep dive?
I'd say nasal red light therapy is out there. It's generally affordable and easy to use. It might help manage allergic rhinitis or hay fever symptoms.
Mm-hmm.
One scientific study showed it gave short-term subjective symptom relief after a single session, but didn't objectively open airways significantly right away.
Okay.
Other sources suggest potential mechanisms like self-stimulation and anti-inflammatory effects, and claim benefits with regular use, possibly reducing reliance on meds. It could be worth considering as a complementary tool.
Mm-hmm.
And remember, redlighttherapy.rehab was mentioned as a resource for more info and links to affordable devices.
Yeah, so for you, the listener, maybe looking for quick, solid info and drug-free ideas for nasal woes, hopefully this helps clarify things. We've hit the potential upsides, what one bit of science found, and the practical points.
And it leaves you with a question, really. Given the low cost and potential for some relief, maybe even checking out that resource, redlighttherapy.rehab,
Mm-hmm.
is this something you might consider trying or discussing with your doctor, especially alongside your current strategies?
Definitely food for thought. And it just makes you think, doesn't it? This whole field of using light for health, it's constantly evolving, makes you wonder what other applications we'll uncover down the line. Thanks for exploring this with us.